of nurses today?
Well, the media does a pretty good job in educating people about healthcare in general, and 90% of people actually say they get their information about health from the media. So what we need to do is reach out to the media, try to get them to portray nurses more accurately, because the images of nurses that are out there right now are largely negative. The most popular shows, Grey's Anatomy, House, Private Practice, they regularly send negative messages about nursing to the public, that nurses don't do anything of value, that physicians do all the work that nurses do in real life, like defibrillation, triage, IV medications, psychosocial care, dealing with high-tech ICU machinery, 24-hour, 7-day-a-week surveillance and intervention. So when physicians get all of the credit for the work that nurses do, they also get all of the money. For instance, they get, for every $1 that nurses get for their residencies, physicians get $375 for their residencies. Nursing research is slightly better, $1 for every $200 of the NIH budget, and nursing education, $1 for nurses for every $50 for physicians. So that level of funding disparity is the true measure of the value that society actually places on nurses. So we must educate the public about what nurses really do to save lives and improve patient outcomes so that we can be a stronger profession, so that we can provide better care for our patients and we can save more lives. Right now we are too weakened as a profession to provide adequate care for patients. I've been in hospitals with family members and friends, and too many nurses don't act as if they are autonomous professionals. Instead, they're meek, and they fail to introduce themselves too often, and they don't assert themselves and tell patients what their assessments are and how these assessments could affect their health. They fail to educate patients adequately. They fail to advocate for them. And when the core tenets of nursing care are not met for the patients don't get what they need. They go home inadequately prepared, and they either return sick again, so we have to take care of them all over again because we didn't adequately take care of them in the first place, or they stay home and die. So none of that is what any nurse would want. Instead, we should be able to provide adequate and excellent care the first time around. And for that to happen, people need to respect nursing, so that, for instance, staffing ratios. People in decision-making roles don't give nurses enough staffing because they don't understand the value in nursing. They think nurses can be replaced by unlicensed caretakers. They think that non-nurses can adequately empty a bedpan, when in fact, if the bedpan is full of blood and the nursing assistant does not know what's in the bedpan, he or she flushes all that data down the toilet, the patient goes home, bleeds out at home and dies, because emptying bedpans was seen as too lowly work for a registered nurse. The same thing with vital sign collecting. I don't believe any non-nurse should be collecting vital signs. That's a nursing assessment, and nursing assistants perform that task with a piece of machinery that's inadequate. And I know from talking to manufacturers of these machines that they're not tested on the sick. I've seen them malfunction. Heart rates of 220 are measured by the machine as 110. It only picks up every other heartbeat. I've seen one malfunction during a code, and I knew it was not working right. So after the code was, the man died. After the code was over, 15 minutes later, I tested his blood pressure, and it was 110/70, even though he's long dead. So these are the tools we give to nursing assistants to collect our nursing data. Nursing assistants are unable to pick up secondary signs, such as a pale color, maybe ashen skin, a bit clammy, a bit having difficulty breathing. They can't pick up these signs. Registered nurses can, even if they're using the inadequate machinery. So we need to take nursing back from people who are not nurses, get decision makers to understand nurses need to be doing all of nursing care, not just that which you deem significant, because they don't understand even the the most basic care because of the media images that they see every day on television that tells people that nursing care is really about this basic serving of physicians' work, this unskilled labor that doesn't require a brain. Yet, as anyone who's ever been to nursing school can tell you, nursing school is very difficult, and we deserve credit for the education that we work so hard to get.
You said hospitals exist for nursing care. Talk a little bit more about that.
Right. If patients did not need nursing care, they would not be in hospitals at all. They'd go to some outpatient center where they still might get some nursing care. But the only reason they're hospitalized is for nursing care. So this is why hospitals exist. And yet, a lot of hospitals do not even have a single nurse on their boards of trustees. And I just find that unconscionable. These are nursing institutions. They should be run by a majority of nurses. And yet we have everyone else in the world but nurses running them, in part because people don't think nurses have anything of value to say. They get that idea from television and other media that relentlessly tells the public that nursing is meaningless scut work for losers, that any modern-day professional who has an interest in health becomes a physician. So physicians dominate boards of directors and other professionals, but not nurses, because nurses are not even seen as professionals, in part because of not just the media, but also the language we use in healthcare. The word orders is often used to talk about the prescriptions that physicians write. I prefer the word prescriptions because it talks about, physicians and advanced practice nurses have prescribing authority. But by no means is a prescription a command to a nurse that he or she do something for a patient. Nurses have ethical and legal obligation to the patient to object to any physician prescription and negotiate with the physician for a better plan of care if he or she writes something that's dangerous or just not the best plan. Nurses are duty-bound to treat patients as if they were the family members of the nurse. That's how you're supposed to treat your patients. If that was your mother in the bed and the physician ordered some dose of heparin that was 10 times too much, would you go and give it just because the physician asked you to do it? That would be insane. No, you're supposed to treat every patient like it's your mother if you have a good relationship with your mother, and fight for them. Educate them, fight for them. And so part of that is using the right language around nursing, not just using prescriptions instead of orders, but using the word physicians instead of doctors. Doctors implies that only physicians can earn a doctoral level education, when in fact nurses and other healthcare professionals also earn this degree. And the word doctor has long been used to elevate to a nearly godlike level physicians, from which you are, if they're somehow godlike, maybe you can't really criticize them or question them. A lot of patients say that they can't talk to physicians about that the questions are concerns that they have about their health care. So the physician comes in for 2 minutes and leaves, and then later they talk to the nurse and they ask the nurse the actual questions that they have because they feel the nurse is much more approachable. So we need to take the pedestal away from physicians, not out of any sort of malice, but out of the need to level the playing field and to show patients and nurses that physicians are human beings just like nurses. They're professionals, autonomous professionals just like we are. And we need to communicate more as colleagues instead of this dysfunctional relationship we have between the professions where they think they're in charge of us when they're not. There is no legal or ethical basis to believe that they control our practice. We have boards of nursing, codes of ethics, nursing schools with nursing professors. We're an autonomous profession, and it's our duty to the patient to start speaking up about our autonomy, to educate the world about the value of our work so that we can provide better care, save more lives, improve more outcomes.